In this video, we're going to look at some of the landmarks of the occipital bone. So first, what we're going to do, we're going to take our skull and we're going to look at the very back of it. So here we can see our occipital bone, and notice how on the back of the occipital bone, if we look from the side, we see this bump right here. This is the external occipital protuberance. Now that's a long name, I know, so let's break it down. External means it's on the outside of the skull. Occipital refers to the back of the skull, specifically the occipital bone, and protuberance, let's break that word down. Pro means projecting out or forward. Tuber is a Latin word that means swelling. That's why we refer to potatoes and other root vegetables as tubers, because they look like swollen roots. So the external occipital protuberance is the swelling that sticks out of the occipital bone right here. You can actually feel that if you run your fingers along the back of your head. You can feel that little bump. Our next structure we're going to look at is this very large hole. So here we're looking down into the skull. We can see it here, or if we flip it over, we can see it right here. Now, this is by far the largest hole on the skull, so we've given it the name Foramen magnum. Foramen means hole, magnum means great. So this is the great hole because it's the biggest one in size, and I think we can all agree it's pretty great. This is where our spinal cord travels up into the skull to meet the brain. Now, if we look at the foramen magnum, let's zoom in on it. On either side, we can see, let's look from the side here, these little smooth knobs right here and right here. These knobs are the occipital condyles. A condyle comes from a Greek word that means knuckle. Now, if you look at my knuckle, notice how it's kind of like a smooth little bump. That kind of looks a little bit like a knuckle, like a smooth little bump. So these occipital condyles are what articulate with our first cervical vertebrae. So this is how your skull attaches to the vertebral column, and they allow you to nod your head. Yes, I do like your anatomy videos, Dr. P. All right, our last feature that we're going to mention on the occipital bone. If I find my occipital condyle and I look at it from the side, I can see a little hole running directly through it right there. Now I'm going to use the non-taped end so I can stick it through this hole, and we can see how that passageway runs through the occipital condyle into the foramen magnum. This passageway is called the Hypoglossal Canal. The Hypoglossal Canal gives passage for a nerve called the hypoglossal nerve. Hypo means below. Glossus refers to the tongue. So the hypoglossal nerve comes out of the hypoglossal canal, comes out here, and then runs down below our tongue. So it's going to control things like tongue movements.